Hello, everybody. Welcome to today's lecture, and we continue covering osseous tissue. In this video lecture, we will talk about physiology. So let's go ahead and begin. Now, how bones are formed and when exactly they are formed. So during embryonic development, your bones are formed either from a membrane or from a cartilage. Formation of bone is called ossification. So if bones are formed from a membranous tissue, we call it intramembranous ossification. If bones are formed from cartilage, we call it endochondral ossification. So we have two types of ossification, and depends what bones we are talking about, right? They were formed by one process or another process. Now, if we're talking about flat bones of your skull and your face, those bones mostly were formed through intramembranous ossification. So let's look at the process in more details. So as I mentioned before, we need to start with the membrane. So over here, this part represents a membranous tissue, and cells within this tissue are mesenchymal cells. Now, mesenchymal cells are embryonic cells, and they are the cells that differentiate into different connective tissue cells. Like in this particular example, when we're talking about intramembranous ossification, mesenchymal cells will differentiate into osteoblast, right? So it says over here, differentiation into osteoblast. Now, osteoblast are cells of a bone that will secrete bony matrix. So you have now osteoblast, right? So here's a cell, this is osteoblast, this one is osteoblast. So where this osteoblast cells came from, or mesenchymal cells, they differentiated into osteoblast. Now, osteoblasts start depositing osteoid, and osteoids start pretty much covering those cells. Now, if you look at this next diagram over here, you can see that some of these osteoblasts that stay inside this area that we actually called ossification center, they get trapped within osteoid, within the bony matrix, and they differentiate into osteocyte. Now, osteoblasts on their periphery of ossification center now start depositing matrix towards the center only, right? So if before they were depositing osteoid, and osteoid is a part of bony matrix, they deposited it pretty much into all directions, right? But when they get trapped, those osteoblasts on the periphery of ossification center now depositing matrix towards the center, right? So osteoid secreted by osteoblast, so matrix undergoes calcification. So if you remember, osteoid is organic part of a bony matrix, and then we have accumulation of calcium within this ossification center. It entraps osteoblasts, turning them into osteocytes, right? That's what we just said. Now, if you look at picture C, now osteoid now secreted around capillaries, forming this spongy bone. And here we still have our osteoblast, right? So this we have still osteoblast. So we have osteoid secreted in around capillaries, making what we call a spongy bone. Now, this osteoblast on the periphery start depositing bone in a lamellar pattern. So it start making lamellae. So it start producing compact bones, right? So here we will have now lamellae of compact bone and membrane on the surface with a mesenchymal form, with the mesenchymal cells, it will form periosteum. All right, so let's see. Trabecular matrix and periosteum form. Osteoid secreted around capillaries, mesenchyme cells on the surface became, so this is mesenchyme membrane became periosteum. Osteoblast deposit lamellar bone, so it's right here on the periphery and superficial to this trabecula. And here we have it. I want to remind you, let me remind you very quickly. So you see what we're doing over here. We are making flat bones. So here, if you look at the structure of a flat bone, right? The flat bone is a sandwich of the spongy bone between compact bone and periosteum covering this compact bone on the surface, right? So we have periosteum, that is a, membranous structure, compact bone, and spongy bone, right? So that's what we actually just formed over here. So if you look back here, we have, let me make it bigger. We have the cells here and here, and those are our osteoblast, right? Here's our osteoblast. And this osteoblast on the periphery start depositing compact bone, right? So we will have compact bone here and compact bone over here. Now this is our mesenchymal membrane that will differentiate into periosteum. So we have periosteum, then we will have compact bone. And in the middle, we have our spongy bone. Because those osteoblasts, they were depositing matrix along the capillaries, right? So that's our intramembranous ossification. So process begins in utero, and flat bones of the skull and face are formed through intramembranous ossification. So last bones to ossify are flat bones of face. They reach adult size at the end of adolescence growth spurt. All right, so again, just to very quick recall, during embryonic development, flat bones form through process that is called intramembranous ossification. Intramembranous means it's gonna happen within a membrane. So we do have a membrane first. This membrane is rich in mesenchymal cells that are embryonic cells. They are undifferentiated. They will differentiate straight to osteoblast. So they differentiate into osteoblast, and osteoblasts start forming ossification center. They secrete osteoid, and osteoid become calcified, right? Now, cells that are trapped within osteoid, that is part of matrix, became osteocytes. Those osteoblasts on the surface now start secreting a compact bone, right, on the both sides. Inside, we continue secreting spongy bone along the blood capillaries. Now, mesenchyme on the surface form periosteum, right? So here we have it. We have spongy bone, right? Sandwiches between two layers of compact bone. Now, all the bones below your skull, with exception of clavicle, are formed through a different process that is called endochondral ossification. So most of your skeleton is made of cartilage first, and then cartilage is replaced by bone, right? So let's see how endochondral ossification happens. So cartilage is a template. So we have cartilage, and it's a hyaline cartilage. And this template is way smaller. So if you compare this one with the bones that will develop from this template, this is way bigger bone. So we have embryonic cartilage that is made of hyaline, embryonic skeleton that is made of hyaline cartilage, right? Then, so the cartilage is covered by perichondrium, right? So we have this covering, perichondrium. So here's the name, perichondrium. Now inside this perichondrium, we have, okay, let's start before I get before I get too far ahead. Here we still have mesenchymal cells, right? Because mesenchymal cells differentiate in all connective tissue cells, and cartilage and bone are connective tissue. So chondroblast, chondrocytes, osteoblast, osteocytes, those are cells of connective tissue. So that means we need mesenchymal cells that will differentiate into those cells. So mesenchymal cells, they differentiate into chondrocytes, and chondrocytes form this cartilage precursor of bones, right? So we form this template, right? Precursor of bones, cartilaginous, right? Now, so we have this template made of hyaline cartilage. We have perichondria. Inside this perichondrium, we still have mesenchymal cells. So we still have mesenchymal cells. And now these mesenchymal cells differentiate into osteoblast. And osteoblast, what it does is start depositing bone. So it's depositing bone right in the middle of this template. This part that became diaphysis. And it's deposited right all around it. Oops. I'm sorry. I guess I exit my share screen. Right, so we have deposition of bone all around this area that's gonna be diaphysis. So if you see here, this is now bone, and we call it bone color. Now, if we have this bony color, we actually reduce nutrient and oxygen supply to the middle of this template. Let me see, right here. So, right, so we reduce the oxygen and nutrient supply over here. Those chondrocytes inside, they became enlarged, and they start secreting different chemicals, and those chemicals will cause accumulation of calcium in this area. So we call this calcified matrix. Okay, now I know it might be a little bit confusing, so let's review. So we're gonna start with mesenchymal cells, right? Mesenchymal cells will differentiate into chondrocytes, similar to what we have over here, right? We had mesenchymal cells, but those mesenchymal cells differentiated straight into osteoblast. Now over here, mesenchymal cells differentiate into chondrocytes, and chondrocytes form this cartilaginous template for our future bones. Okay, so now this cartilage, cartilage is avascular. It gets nutrients and oxygen by diffusion, right? And cartilage is covered by perichondrium. Now within this perichondrium, we still have mesenchymal cells left, right? So it says over here, mesenchymal cells still left in pericardium, differentiate now into osteoblast. This is what these mesenchymal cells do. They differentiate into different cells. When they differentiated into chondrocytes, chondrocytes made this cartilage for us. Now they differentiate into osteoblast. Osteoblasts start forming bone color. Now when we form bone color, we have changes happening inside this cartilage. This cartilage, those cells, chondrocytes, became enlarged. And when they enlarge, they start secreting chemicals that allow a lot of calcium accumulation in the area. So we call it calcification. Well, when we have calcium, right, this area became really hard. So we have minerals depositing, and the chondrocytes start dying. Interesting, right? They deposit this calcium and they start dying because of that, right? And when those chondrocytes die, right, we have cavity. This would happen next. We have embryonic blood vessels growing towards this area. And those blood vessels start bringing here, so your chondrocytes are dead. So blood vessels gonna bring here the osteoprogenitor cells. So it says here, capillaries penetrate cartilage. So here we have penetration of this cartilage by capillaries. Capillaries invade space of dead chondrocytes, enlarges cavities, brings osteogenic cells, and osteogenic cells, they start depositing bone over here. So this is the formation of primary ossification center. So we form actually spongy bone here, but then the spongy bone will be reabsorbed by osteoclast. So then we not only have bone forming cells, osteoblast, we also will have osteoclast, and they will resorb the spongy bone. So finally, we will end up with a cavity that is called medullary cavity. All right. Now, cartilage, now we have on the ends of a bone, and it's continued to grow. So you can see, compared to this template, this is a little bit longer, this is a little bit longer, right? Because cartilage divides and bone actually grows in both directions. Right, when the baby, so we have the primary ossification center formed during embryonic development. You know, finally, we have this cavity formed, right, with a lot of blood vessels. So we have medullary cavity. We will have compact bone formed, and we will have periosteum covering this compact bone. And we will have hyaline cartilage on both ends of long bones. Now, after baby is born, we will see the development of secondary ossification center. So we will have blood vessels growing toward the epiphysis of a bone now, and the process pretty much very similar, right? The cartilage will die, blood vessels will bring osteogenic cells. Osteogenic cells will deposit spongy bone over here. The only difference is we call it complete ossification. We will not form cavity here. We will form spongy bone in the epiphysis. When in diaphysis, we form spongy bone first, and then we destroy this bone through activity of osteoclast and created a cavity. But in a secondary ossification center, we have complete ossification, so we'll have spongy bone. And whatever is left from the cartilage, so cartilage remains, we will have articular cartilage on the surface. And this articular cartilage will articulate with another bone that will form joint over here. So here maybe we have another bone that articulate with this bone, and it's also will have cartilage. So we have a joint, and we have articular cartilage as a part of this joint structure. And another remaining of cartilage is actually this area right here that is called epiphyseal plate. And this epiphyseal plate exists till we reach age of 20. So when our bones are still getting longer, because you know bone cells cannot divide. So for our bones to grow longer, we must have this cartilage. So this cartilage will divide, the bone will grow longer, and then cartilage will be replaced by bone. And it will continue until, as I said, approximately age of 20, when we stop growing, then this epiphyseal plate will be replaced by epiphyseal line, right? So for example, if we have a young person that is short for his or her chronological age, the doctor might take X-ray of his or her bones, and they will look at this epiphyseal plate. And if we still have epiphyseal plate, that means that this patient will still grow taller. But if we see epiphyseal line, that means those bones are not gonna grow any longer, right? Because we pretty much used all the cartilage was ossified, it became a bone, so the bone stopped growing, right? So let's see what we have over here. Well, okay, I didn't want to stop sharing, so I will go share again. Right, so what did we cover so far? We're talking about ossification. We mentioned that bones are formed during embryonic development and we continue ossification even after baby is born. But we have two types of ossification: intramembranous, when bones are formed from membrane, and endochondral, when bones are formed from cartilage template, right? Now there is some diseases, and both are genetic conditions called achondroplastic dwarfism and cleidocranial dysplasia. And those when no, this condition happen when somebody is born with a mutated gene that is responsible for ossification that we just covered. So if somebody has problem with endochondral ossification, it might result in a condition that's called achondroplastic dwarfism. So here we have problems with long bone growth, right? So you can see, you know, the cranial bones and facial bones has normal adult proportion, but arms and legs are shorter for these people. And this is Peter Dinklage, the actor from Game of Thrones, and he has achondroplastic dwarfism. So at some point of, you know, his development, endochondral ossification, you know, there was some problem with endochondral ossification with this one, right? When this guy, I don't know if you know him or not, Matarazzo, Gaten Matarazzo from Stranger Things, he has cleidocranial dysplasia, and this indicates problem with intramembranous ossification, with this one, intramembranous ossification. Okay, now we mentioned, right, that bones continue to grow until we have, you know, this cartilage that can divide and increase the length or the width of bone. Now, actually, we have two types of bone growth. It can be apostitial and interstitial. I'm sorry, apositional. Apositional and interstitial. Now, interstitial, I remember it's like if you have letter I kind of like, you can put arrow on both sides. So the bone is grow longer, interstitial, and appositional, the bone is grow wider. And so let's see, let me just remove it. So I don't need my arrows over here. So this is how bone will grow longer. So here we have osseous tissue, we have bone tissue, right? And we have cartilage left. Remember, we have articular cartilage here, and we have our epiphyseal plate right there, OHO over here. Now the cartilage will grow right there and over here, because cartilage has this, ability to divide. So when you divide, you have more cells. So you have more cells, you obviously increase this area. So this area became, bigger. So you grow up, right? So that's, your bone is growing. And then this part and this part will be replaced by bone. So you have cartilage kind of growing on the top, but the cartilage underneath will be replaced by bone, right? So that's going to be ossification. So cartilage growth here and cartilage growth here and cartilage replaced by bone over here and over here. And this is your new bone now, right? You see it grow longer, but now it has a different shape. So now you need to remodel it. So you need to resorb the bone, and this will be a work of osteoclast. So we will have osteoclast that resorb bone where it's need to be removed, right? So over here and inside, because we need to keep this, cavity. So that's our medullary cavity. So we will resorb bone over here, resorb bone over here, and we're gonna add bone on this side. So, so bone getting longer until we still have cartilage in epiphyseal plate. And this is where the bone will grow longer, and then we will remodel the bone right through the our appositional growth, right? Because when the bone grow this way, this is apositional, and when it grow this way, get longer, it's interstitial. Okay, so let's look at epiphyseal plate one more time. So where we at? We actually in this area right there, right? So this is our epiphyseal plate, and we just kind of magnify it and look closer. So we have cartilage, right? So we have cartilage, and cartilage we have different zones of cartilage. So we have reserve zone. So here we have our chondrocytes inside the lacuna, and we have our amorphous matrix. So that's our hyaline cartilage. Then these chondrocytes, they start dividing through the mitosis. And we have the whole, like bundles or columns of these chondrocytes, you see. That's we call proliferation zone or proliferative zone. Now we have maturation or hypertrophy when those cells became larger, right? And when chondrocytes became big, right? Changes happens, right? So these cells, chondrocytes, when they hypertrophy, they start secreting enzymes and chemicals that would cause accumulation of calcium in the matrix. So that's our calcification zone. And when that happens, chondrocytes die. Right, but through this process, we already made this bone longer. Now, when cells die over here in calcification zone, we replace this area by bony tissue, right? So this is our metaphysis, and this is our ossification zone now. Now we have our osteoblast, and osteoblasts start depositing osteoid. So we have already calcium, we start depositing depositing osteoid, and this part is now is a bone, a new bone, right? So where do we have older cartilage? So here's our, we go down here, we have older cartilage, and then cartilage is replaced by bone in the ossification center, right? So reserve zone closest to epiphyseal end plate contains small chondrocytes. So here's our small chondrocytes, right? Then we have proliferation or proliferative zone, where we have a division of the chondrocytes. So we make new chondrocytes to replace at the epiphyseal end. Then we have maturation or hypertrophy, where we have older and larger chondrocytes, right? And then we have calcification zone that is closest to the diaphysis, so to the, you know, shaft of the bone. And when we have calcification of the matrix, chondrocytes dies. Now capillaries penetrate here, and cartilage that is dead now is replaced by bone. So this epiphyseal plate continue, you know, this process. I mean, those chondrocytes within epiphyseal plate continue dividing, grow bigger, calcified, and then die, and bone getting longer until all the epiphyseal plate, cartilage of the epiphyseal plate is gone. It's replaced by bone, and we have epiphyseal line instead, right? And the growth stops. This is a histology slide of the epiphyseal plate. So you have pretty much the same resting cartilage, right? Then you have zone of proliferation. So you see like these columns of cells. Then we have hypertrophy. So you can see cells became bigger, right? Then we have the cell death, or, you know, calcification. So those dead cells, because we have hard matrix now, right? So those cells are dead, and we call it calcification zone. And now over here, we have ossification zone. So this is ossification. This is calcification. This is hypertrophy. This one is proliferation, and this is our resting cartilage. And this is our epiphysis. So diaphysis will be right there. Okay, so this is how your bones are growing longer. And yeah, we go through all this process because it's just bone cells, they don't divide. If something don't divide, you cannot increase the size of your organ, right? But we already mentioned that bones can also grow through oppositional growth. Now, when the bones get wider, this is what happened in this scenario, right? In this situation. So this gray structure here, this is our periosteum. So that was the surface of the bone. Now, osteoblasts beneath this periosteum secrete bony matrix, forming the ridges. So here's the ridges that follow the course of blood vessels, periosteal blood vessels. As the bony ridges enlarge and meet, this groove became a tunnel. So now we have a tunnel containing blood vessels. Now, periosteum that inside the tunnel, right? Remember, it was our periosteum. Now it's transformed into endosteum, and osteoblast deep to this tunnel secrete bony matrix, narrowing this canal. You see how it became narrowing, and it became our central canal, right? As the osteoblast beneath the endosteum form new lamellae, a new osteon is created. So here's our new osteon, right? So we didn't have it, now we have new osteon. And then we will have circumferential lamellae deposited in this area, and then the process continues, right? This is how your bone increasing or enlarge in diameter, right? This is called appositional growth. Osteoclasts resorb old bone, and osteoblasts produce new bone, and it's also referred as bone remodeling. We remodel our bones through adult life. About 5–10% of skeleton annually is a new skeleton, right? So that's pretty amazing. And this helps us to keep our bones healthy. Right, so that was ossification and bone length and how our bones became larger in diameter. Right, so we're gonna end up with we're gonna end this lecture with some homeostatic imbalances, right? And we also talk about hormones that you need for your to keep your bones healthy. So let's look at types of fractures. Fracture means broken bone, and it can be closed reduction or open reduction. Can be classified based on complexity, location, and other features. So over here, this is classification based on location, like transverse, linear, oblique. This classification based on complexity, so it's a displaced. This one is spiral, green stick. You know, it's when not the bone is not broken all the way through, right? Just part of the bone, common in children, or comminuted, shown here. But you have the whole table that explain your type of fracture. Transverse, straight across the long axis, oblique at angle that is not 90 degree, spiral when bone segments are pulled apart as a result of twisting motion, comminuted when we have several breaks, result in many small pieces between two large segments, so that our comminuted between two big segments, that's a big segment, this is a big, and we have small in between. Impact when one fragment is driven into the other, usually as a result of compression. Green stick, partial fracture, in which only one side of the bone is broken, common in children. Open or compound and closed or simple, a fracture in which at least one end of the broken bone tears through the skin, carries a high risk of infection, or closed or simple fracture in which the skin remains intact. Now, when bones are broken, luckily for us, we go through process of bone repair. And it has several stages. First stage is formation of hematoma, resulting of damaged blood vessels. So if you break a bone, it's very vascular structure, you break or you cut through the blood vessels, you have bleeding, that's what hematoma is. Those, bone cells are dead. Within about 48 hours, we already have formation of calli. So we have internal callus and external callus. Because we have this periosteum, and periosteum has osteoprogenitor cells. So we have cells that have this ability to differentiate and divide. So some cells will differentiate into chondrocytes, and the chondrocytes will produce a cartilage. So we will heal by formation of cartilage first, and it will be fibrocartilaginous callus. So we'll have collagen fibers, and we have cartilage forming this internal and external callus. And then we go through process that we just discussed, process of ossification, when this cartilage is replaced by bone. So we have formation of bony callus, a spongy bone first, then on the surface we start depositing compact bone, and on the surface the spongy bone will be replaced by compact bone, and for many months and maybe even years we have remodeling, right? So when we resorb a part of this callus, we will deposit some bones in the area where it's need to be deposited, but bone will heal completely, and actually bones heal so well that it's very, very rare it is broken in the same area twice. So bones almost never are broken twice in the same area. Of course, if we're talking about healthy bone, enough of minerals, enough of vitamins, and no any conditions or disease, but bones heals pretty good. It's a vascular tissue, and vascular tissue has tendency to heal well. Okay, the basics. Exercise, important for your bone health. Mechanical stress stimulates deposition of mineral salts and collagen, thickens your bones, give you a greater bone density. You need calcium and vitamin D. Vitamin D is needed for calcium absorption. You need vitamin K that supports bone mineralization. So here's a summary of nutrients. You need calcium, vitamin D, vitamin K, magnesium, and fluoride, the structural component of a bone. Omega-3 fatty acid reduces inflammation that may interfere with osteoblast function. And remember, osteoblasts, they deposit a bone matrix. So you also require lots of hormones for your skeletal system to function properly. You need growth hormone that increases length of long bones, enhances mineralization, and improves bone density. Thyroxine stimulates bone growth and promotes synthesis of bone matrix. This one released by thyroid gland. Sex hormone, and especially testosterone. So when we're talking about sex hormone, testosterone, they promote osteoblastic activity and production of bone matrix responsible for adolescence growth spurts, promote conversion of epiphyseal plate to epiphyseal line. Calcitriol, I don't know why it's in the hormones, it's actually vitamin D. Oh yeah, but it's, because it's your skin synthesize precursor of vitamin D, we can consider it to be a hormone. So this one stimulates absorption of calcium and phosphate from digestive tract. Parathyroid hormone stimulate osteoclast proliferation and resorption of bone. And we do need resorption, right? Because we need remodeling. When your bones are grow longer, we wanna resorb part of it and deposit some new bone. So the process of remodeling requires parathyroid hormone, because parathyroid hormone stimulates osteoclast. And calcitonin inhibits osteoclast activity and stimulate calcium uptakes by bone. So we have several hormones and of course nutrients necessary for bone health. And the last slide over here is calcium homeostasis. Now, calcium is extremely important element that you need. This concentrations that show 10 milligrams per deciliter, this is your calcium blood level. This is critical for not only for your skeletal system, but for your muscular system, for your nervous system, for endocrine system. So very important element, calcium, right? So you need to have these 10 milligrams per deciliter normal calcium blood level. Now, when you increase the calcium in the blood, right? So what do you want to do? You want to remove calcium from blood, right? So if you want to remove calcium from blood, the thyroid gland release calcitonin. Osteoclast activity is inhibited because remember what osteoclasts do, they deposit even more calcium in your blood. You don't want it, right? So you inhibit osteoclast. Calcium reabsorption in the kidney decreases. That means you remove calcium from your with your urine, right, from your body with the urine, and this decreases calcium blood level. So we go up, we want to through negative feedback go down. This, however, calcitonin is not that important in the calcium balance. The most important hormone for calcium level is parathyroid hormone. So you just increase more, secrete more or less parathyroid hormone. And yes, calcitonin helps, but the most important hormone is parathyroid. And parathyroid hormone released when calcium blood level in the blood drops. If you don't have enough calcium in your blood, you want more calcium in your blood, right? So what are you gonna do? You wanna stimulate osteoclast. Okay, go ahead and break down this bone matrix and release calcium from bone to the blood, right? Because you want this 10 milligrams per deciliter in your blood, right? Where do you store calcium? Inside your bone. So you don't have enough calcium in blood, you resorb bone, you break down bone, and you release calcium into blood. And this is what osteoclast does. And parathyroid hormone stimulates osteoclast to release this calcium. Now, kidneys, what do you want your kidneys to do if you do not have enough calcium in your blood? Do you want to get rid of calcium with your urine? No, you want to reabsorb calcium back into blood, right? So you decrease the amount of calcium in your urine and you keep this calcium in your bloodstream. Now, again, you have low calcium level in the blood. What do you want to do in your digestive system? You want to increase absorption of calcium in your digestive system and via vitamin D synthesis. So you synthesize more vitamin D, you absorb calcium from your food to your blood, and your blood level goes, the calcium blood level goes back to normal, right? Now, let's see what happens when you have hypocalcemia and hypercalcemia. Neither one is good for your health, right? Hypo means low calcium level. It's a difficult coagulation. It's heart skipping beats and the brittle bones, right? Not enough calcium. Too much calcium, hypercalcemia, lethargy, that is no energy, constipation, confusion. So very important homeostatic control mechanism of a calcium level in your blood. So you store calcium in your bones, and when you need it, you will release it into your blood. Because remember, you need calcium not only for health of your bones, you do, but also for your nervous system, for muscles, for glands to function properly, right? So that's it for this lecture, right? We covered the physiology part of the osseous tissue. Thank you for watching, and I hope it was helpful.